All right, let's just get right into it. If you've ever found yourself staring at a pile of Medicare paperwork, feeling like you totally missed a mandatory class that everyone else in the world somehow took, well, this is that class. We're going to pull this whole thing apart so it actually makes sense.
Yeah, does that sound familiar? It's that voice in your head, right? When you're looking at Part A, Part B, Part C, Part D, and you just feel like you're the only one who's completely lost.
And I really need you to hear this. That voice is wrong. Your confusion isn't a you problem. It's not a personal failing. It's actually a design flaw in the system itself. And today, we are going to unpack that design so that it finally clicks.
So, let's start. Welcome to the class you never had. We're not just going to go through a glossary of terms here. No. We are going to build the foundation, the context, that makes the entire confusing system suddenly snap into focus. See, this isn't about what you don't know. It's about the fact that nobody ever really gives you the full picture. So our goal today is super simple. We're going to give you the actual map to Medicare. Not a sales brochure, not a list of acronyms, but the real guide to how this thing is built, and more importantly, where the biggest decisions are hiding.
Okay, here we go. This is probably the single most important idea that's going to make everything else clear. You have to understand that Medicare wasn't designed all at once. It was bolted together in pieces across almost 40 years.
Look at this timeline. Look at that massive gap in the middle. For 38 years, Medicare was just for hospitals and doctors. It had absolutely zero coverage for prescription drugs. I mean, just think about that. The main health insurance for seniors in America didn't cover medicine for nearly 4 decades. It's kind of wild when you see it laid out like that.
And that is the big aha moment. If the different parts feel disconnected and confusing, it's because they are. Each one was a patch, a separate law created years, sometimes decades apart, to fix a problem the last version created. So what you're feeling isn't confusion. You're just accurately sensing the strange architecture of the whole thing.
All right, so now that we have that historical key, let's walk through the map. Let's look at what each part actually covers, what it's going to cost you, and this is the important part, what it doesn't cover. Let's start with Part A. Think of this as your hospital insurance. If you're admitted as an inpatient, this pays the bill. Now, for most of us, there's no monthly premium for this part because we've paid for it our whole working lives through payroll taxes. But here's the first major gap. Part A covers the hospital room, but it does not cover the doctor who comes to treat you in that room. And that's exactly where Part B comes in. This is your medical insurance. It covers your doctor visits, outpatient stuff, lab work, preventive screenings. This part does have a monthly premium. And when you put A and B together, that's what everyone calls Original Medicare.
And please, if you only remember one thing, remember this. This is the single biggest, most critical financial gap in the entire system. Unlike the health insurance you probably had from work, Original Medicare has no annual limit, no ceiling on what you could be forced to pay out of pocket. A really serious health issue could expose you to literally unlimited costs. This is why a whole industry of Medigap plans exist. They sell you another policy to plug this massive hole.
So then you have Part D. This is the patch that finally, after 38 years, filled that drug coverage gap. It's a totally separate plan you have to buy from a private insurance company. And this is a great example of how the system is always changing. Because starting in 2025, a huge new rule kicks in. There's now a $2,000 cap on what you can pay for drugs in a year. For people with expensive prescriptions, that is an absolute game changer. And finally, there's Part C, which you probably know as Medicare Advantage. Now, this one's tricky. This is not an extra benefit on top of Medicare. It's a different path. It's an alternative. You're basically choosing a private insurance company to deliver your Medicare benefits for you. They bundle everything together, A, B, D, and sometimes some extras like dental. The big trade-off? You have to play by their rules, and that almost always means using their network of doctors. So, everything we've talked about, the history, the parts, the gaps, it all leads up to this. It leads to the single most important decision you have to make right when you start. It's a fork in the road.
When you first become eligible for Medicare, you arrive at this fork, and the choice you make right then can be incredibly difficult and sometimes impossible to undo later. You either go down the path of Original Medicare or you go down the path of a private Medicare Advantage plan.
So let's just lay out the fundamental trade-off. Path 1, Original Medicare, gives you this incredible freedom. You can go to any doctor, any hospital, anywhere in the country that accepts Medicare. No referrals needed. But it comes with that terrifying uncapped financial risk unless you buy a separate Medigap plan to protect yourself. Path 2, Medicare Advantage, solves that problem. It has a built-in cap on your costs, but the trade-off is you are now restricted to that plan's network of doctors. And you'll likely need permission from the insurance company, prior authorizations for certain tests and procedures.
So you see, the question to ask yourself isn't which one of these is better. The right question is, which gap am I more willing to live with? Are you more worried about the potential for unlimited medical bills, or are you more worried about being restricted to a network of doctors? And the answer to that is deeply personal. It depends entirely on your health, your finances, and what you value most.
Okay, before we finish, I want to leave you with 3 rules. These are non-negotiable. Seriously. Understanding these 3 things will protect you from the most common and the most expensive mistakes people make when they're signing up. Rule number 1. The enrollment windows are not suggestions. They are deadlines and they are not flexible. Your initial enrollment period, that 7-month window around your 65th birthday, is absolutely critical. If you miss it and you don't have other qualifying health coverage, you will be penalized. You will pay a higher Part B premium permanently for the rest of your life. Rule number 2, your supplement rights can vanish. The first time you sign up for Part B, you get this one-time 6-month golden ticket. It's called a guaranteed issue right, and it means you can buy any Medigap supplement plan you want, and they cannot turn you down or charge you more because of your health. If you try to switch from an Advantage plan to a Medigap plan later on, in most states, that golden ticket is gone. They can and often will deny you for pre-existing conditions. That door closes. And rule number 3, the easiest one of all. Before you sign on the dotted line for any plan, Advantage, Part D, anything, you demand to see the official summary of benefits in writing, not the glossy sales brochure. This is the legal document that lays out the real costs, the real copays, the real coverage. And you know what? If an agent or a company is hesitant to give that to you, that tells you everything you need to know. So let's just quickly recap the big ideas. Number 1, Medicare is confusing because it's a historical patchwork, not a single coherent plan. Number 2, Original Medicare's biggest weakness is that it has no out-of-pocket maximum, and that leads to number 3, your main choice is a trade-off between the freedom of a huge network and the safety of capped costs. And finally, number 4, when it comes to enrolling, timing is absolutely everything. You now get it. You really do. You understand the fundamental architecture of this system in a way that, believe me, most people never do. You know why the gaps are there, and you know what the core trade-offs are. So I want to leave you with this question to really think about. When you first started down this road, what was the one thing you desperately wish someone had just explained to you, plain and simple? Answering that for yourself, that's the first step to being truly in control.